So it could get very overwhelming. Like fourth year, there was times where I just like had so much on my mind. I was constantly typing down.
It sounds like, so if you want to be a dentist, to any listener out there that's listening, basically, so you go to high school, you finish that, you do your undergrad.
It's just so it's I think six different sections. And it's like a game pretty much. You're
How's it going, everybody? Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno, and really excited about this one today. Ehsan, we've been trying to get this together for a while now, right?
I know, bro. Finally.
It's been years. This is my buddy Ehsan. He just graduated from dentistry school, and I'm gonna let him introduce himself right now. We go way back. We went to Ryerson together for our undergrad years. And with that, no further ado, Ehsan, take it away, buddy.
Hi guys, my name is Ehsan. Uh yeah, we're buddies from undergrad days, and I just graduated from my program at U of T 2 weeks ago after a long 4-year journey. So yeah, finally got the degree.
Basically, the story goes that about, oh, I don't even know how many years ago now. I would say maybe about 8 years ago, we were both in pre-med together for the most part. And then I wanted to do medical school, and Ehsan wanted to do dentistry school. And then the way it worked was we were in pretty much all of our classes together at that point in our final year. And then we had our interviews side by side. So we also got to help each other practice for interviews. And then Ehsan got accepted into U of T, and that was really, really awesome. And then I got accepted to McMaster for med. How was dentistry school? Like, you just graduated. How does it feel to be done?
Uh I don't know, bro. It's kind of I still feel numb. Like it hasn't really hit me, but it was long, man. It was definitely a ride. Like they put us through so much,
Yeah.
so much, so much. Towards the end, I had 40 patients that
Wow.
I had to like manage on top of like all the schoolwork and exams. So it could get very overwhelming. Like fourth year, there was times where I just like had so much on my mind. I was constantly typing down like what to do or what to do next so I don't forget. So yeah, it was a lot, but it was good. We
Awesome. And
finished.
we'll get into all those details in just a little bit. I brought you on today, and the reason why I've been talking about doing this for so long is because I have a lot of students in undergrad and even in high school message
Mhm.
me about dentistry school. They're interested in the field. They want to know what the process is like, how to apply, and then what it's like when you're actually in. And to be honest, I didn't really know much about it. So I'm glad that we have Ehsan to come on and talk to us about it a little bit today. But first, Ehsan, tell us a little bit about your story, because Ehsan will never admit it for himself because he's a really humble guy, but Ehsan's probably one of the smartest people that I've ever met. He's always been someone that in undergrad we've kind of worked together and helped each other out, but he was a really big help with a lot of the courses and studying together and such. And you have a really awesome story. So where did you grow up?
Thank you, bro, for the kind words. I'm from Iran, so I moved here in 2014. So then I started, I did 1 year of high school, and then we started Ryerson together. I think for me it was 2015, and then yeah, 4 years of undergrad, and then till 2019, and 2019 to 2023 for so 8 years.
Yeah, yeah.
Yeah.
And then I remember, so, and you had said this before, but we'll just touch up on it again. So you're into soccer. You do music? Like, what type of music do you do?
Like basically like play like I play electric, classical, and acoustic guitar. So I like just layer them on top of each other. I don't know like what genre they fit in.
Yeah.
I think it
I remember
could be
you were in a
alternate.
band, right? You used to play in a band, I think?
I had a band in Iran.
Yeah,
Yeah. So we covered like mostly like metal songs, like a lot of Metallica songs.
yeah.
Yeah, I still like have all of them memorized. So
That's awesome.
yeah, that's good. But no, I record a lot of my stuff, so I have like a whole audio interface set up with like all my guitars.
Yeah,
I like edit them. It's fun.
yeah.
It's time consuming, but it's fun.
Well, you got to do something outside of the studying and everything too. So I'm glad that you're still able to do some of that stuff. And then with swimming, if I remember correctly, you were like kind of semi-professional or like training really intensely for swimming back in Iran before you came here.
Yeah, Yeah, I did like 6 years of like competitive swimming. So we had like a swimming team. We would have like intense sessions. Like, yeah, it was fun.
And
6 years, I would say. When I got into high school, it kind of like I chose the school route over, you know.
that's one thing that you don't know about Ehsan. I know I said it before, but I went so long knowing him without knowing all these really cool details about him. He's like an awesome musician and like a competitive swimmer, and he plays soccer and all this stuff. So that's why I just kind of want to piece this out a little bit more. But Ehsan, okay, so let's take it from the top. When you decided that you wanted to do dentistry school, was this before you even went into pre-med, or did you go into pre-med at Ryerson thinking that already you were interested in dentistry?
Yeah, so I knew like from before going in, like in Iran, you have to choose which path you know how like an undergrad here you sort of to like do a first year of like general life science, and then you like choose a major and like kind of narrow down on one field. There is like high school for us. So like going from grade 9 to 10, you have to choose if you're going to the bio path or if you're going to like math and engineering path,
Got it.
or or like religious studies. So there's four paths.
Okay,
So like I knew basically from grade 10,
got it.
um, I want to do dentistry.
Awesome.
And it basically like yeah, started like shadowing dentists, and I always liked healthcare, and I didn't want to be like I didn't want to go to med school because my parents kind of like scared me away from it. They're both doctors. Like my dad's a surgeon, and like it's pretty intense. I'm sure you know. Like
I
he's a
remember
urologist.
I was just about to say urology. Yes.
Yeah, so it's like I don't want something as stressful or as you know it's pretty demanding. Like it's pretty high risk.
Yeah.
Um, I like the fact that dentistry is more laid back and not as stressful. Yeah, so I always liked dentistry since like shadowing dentists in
Well, I
grade
also
10.
remember too, you had told me once that you really liked the technical aspect too, that you liked the best parts of surgery, but you wanted to leave the worst parts of surgery. And a lot of that just lined up really nicely with dentistry. Is that kind of fair to say?
Absolutely. Dentistry is very like versatile. Like there's so many things you can do. Like from ortho to like if you're into more intense surgery stuff like extractions or implants, sinus lift, grafts, you can do that. If you want to do something as chill as ortho or just like fillings and endo and things like that, you can. There's so many different things you can like choose from that sort of like it doesn't get boring, or you can choose what's right for you. So that's another thing I really like about dentistry. Like I for example hate doing dentures.
Okay.
I just don't like them, you know. So you just choose the stuff you like. So for
Sure.
me, yeah, there's a lot of like the stuff I like that are hands-on. Like I also love the surgical stuff. Like
Yeah.
yeah, absolutely.
And I'm glad that dentistry has that. I've heard that before, but similar to medicine, you kind of get to pick and choose where your interests line up and kind of shape your career and end up going in that particular direction, right? We'll get into that 'cause I'd love to know where exactly you're going to take your career at, or where you think you are, anyways, now that you graduated. But the process of how you actually got into dental school, right? U of T dentistry, very competitive program. I could say that our pre-med was the same. It's a 4-year undergrad that we took at Ryerson at the time. It's not called Ryerson anymore. But then after that, what happened? Did you apply in your third year, your fourth year? When was the first time you applied to dental?
Yeah, so you could apply after 3 years.
Mhm.
At least like at the time, that's what they required. They changed like the little details a little bit, but for more or less a minimum of 3 years of undergrad studies.
Okay.
Um, I didn't. I applied like after my fourth year, so I got my degree similar to you. We were
Yep.
together. Yeah. So fourth year I applied. I wrote my dad 2 times. So I wrote my dad in the third year and in the fourth year.
Yep.
And then I used the fourth year grade to apply because it was better.
Yes. If you
But
don't mind,
yeah,
expand on that a little bit, because I know nothing about the DAT. I know that it is the dental like MCAT equivalent. Is that right?
pretty much. It's like an easier version of MCAT.
Okay.
A shorter, yeah, shorter, less sections, less questions, pretty much. Like the the reading comprehension section is less complicated than the MCAT one you have with the cars and everything you're telling me about.
Yeah.
Basically, it's 4 sections. For the Canadian one, for the US one, I think they have math as well. I never looked into it.
Okay.
But the Canadian one is bio, chemistry, reading comprehension, which is 3 passages with 50 questions.
Okay.
And then PAT, which is like the 3D stuff that you have to like mentally rotate and like think what they look like from each different aspect.
I'd love to hear about that because I've heard about it before. Sorry to cut you off, man. Please tell me more. Like what's that like? Because we had nothing that's not on the MCAT at all.
It's just so it's I think 6 different sections. And it's like a game pretty much. You train your mind, and after a while you just see it and you get faster at it. It's literally like a pattern recognition type of exercise that you would do like on games on your phone. And after a while you start to see it. So there's different sections like I think pattern folding is what it's called. So they fold like the paper and punch holes, and then you undo it, and you're supposed to like know where the holes are. So it's a lot of like unfolding and rotating. Like they give you like a 3D object, they show you what it looks like from the top and the side view, and then they ask you what it looks like from the end view. But it's just a matter of exercising. It's not it's something you haven't been exposed to before. So it's unique to the DAT exam, and that you have to just train your mind and do questions, and then you'll pick it up after a while.
And my thought is that the benefit of that is that it helps orient you inside a mouth afterwards when you're trying to do procedures, or do you know exactly why that might be tested?
I mean, it definitely is like stretch in terms of like how applicable it is and how relevant it is. You do need to sort of like be able to visualize things in 3D. And when it comes to dentistry, especially with x-rays, sometimes things are superimposed. Sometimes like when you move the x-ray beam in a certain direction, then 2 objects that are superimposed like move in like a certain way relative to each other, which is kind of like one of the few things that I've found like similar to the PAT section of the DAT exam, like in terms of like having to visualize things in 3D, because it is a 2D image that you have to like picture what it actually is in the mouth in the 3D form. But I mean, in terms of like if you're good at that, it doesn't mean you necessarily do good at the test. It's just more like practicing those specific questions for the specific section of the test, and opposed to like having it translate into a better dentist,
Yeah, for sure. Okay, so you wrote the DAT, you said you used your second score, and then you used your undergrad marks, obviously you applied, and then there was an interview. Is the interview process similar? Was there like, I know the answers to some of this stuff because we practiced together, but let people know, what was the interview like for you?
Of course. At the time of when we were doing it, it was MMI. I know they changed. It used to be a panel format before, where they had 3 people and like a 30-minute long sort of situation. They might have switched to a panel format again. I haven't kept up with like how I don't know what it is now. I think it might be a panel format now. But for my year and the year after me, it was MMI. But it was a lot less intense than what you went through. Ours was only 3 stations. And it was 3 proms and 10 minutes each.
Okay, sounds good. And then we both got accepted in around the same time. And then I remember it was really nice because then I was asking you and you were kind of asking me like, what was dental school like, right? Like you started, I think school starts for you guys in September. Is that right?
That's right.
And what was first year like for dental school, just coming out of pre-med? Was it like a big jump for you? Or did it get really hard really quick? Or did they like ease you into it or?
Honestly, yeah. Like we didn't really take an anatomy course at Ryerson,
Yep.
TMU. Um, and the anatomy is pretty heavy, like in first year. Like you just dive into it, and it's so much information. It's a full year course, and it's stuff I'd never learned before, like head and neck anatomy.
Yeah.
Like, I mean, I had never been exposed to it before.
Yeah.
So it was a whole lot of details, but it's also like the rest of the body anatomy, like the arm and the leg,
Yeah.
and like everything pretty much. But specifically for dental school, I know that head and neck is emphasized.
Right.
So
But I think that's what shocked me when you told me that you were doing anatomy everywhere. And I think not a lot of high school students, especially, might not know that. But dental school, they cover way more anatomy than just the head and the neck and the mouth, right?
yeah, absolutely.
Yeah.
It's I mean, it's tough. I guess they have to go through it. In terms of like it being relevant, it's really not.
Mhm.
Like similar to a lot of content that we covered in other courses. You
Yeah.
just have to do it because it's part of the journey
Right.
type of thing. It's not so much like you're never going to remember it.
Right.
Like I don't remember the details, nowhere near the details we covered when it comes to leg anatomy, head anatomy, because you're just not exposed. Like you don't ever see it on a day-to-day basis. Head and neck, on the other hand, that's all we do. Like inject. You know, when you freeze the patients, which nerves are you hitting? When you're doing like extractions, where the important anatomical landmarks are that you want to avoid, the nerves, you know, the arteries that you don't want to, you know, mess around with.
No,
Uh,
most definitely. And
yeah,
it's exactly what you're saying. It's the whole use it or lose it type thing, right? It's the reason why, depending on what medical residency your program, depending on what medical residency you're in, you're not going to remember necessarily everything from school 10 years out into practicing, right? If you're going to be a plastic surgeon, then you're probably not going to remember the intricacies of all the different antipsychotics or anything like that. And it's just, that's the process of specializing, right? But you're right, it is part of the process. And then speaking of the process, from my understanding, dental school is kind of similar to medical school in that the first 2 years are like really course heavy, and then the second 2 years are a lot of like practical stuff. Is that right?
absolutely. Yeah, first and second year is almost yeah, almost all theory, I would say. We do have hands-on stuff. We have a lot of mannequin stuff, but I mean, I guess they're important, but it's a completely different experience once you get into clinic and you work on actual patients.
Yeah.
I mean, I guess it helps develop the motor skills when you work on mannequin, but to me, it was just like so much. The learning was so different and so much more once we actually translated into clinic. So yeah, I would say first and second year, what I took from it was mostly like theoretical stuff, a lot of like knowledge, and then third and fourth was when it was mostly clinic.
So now that you graduated and you had the last 2 years of like in-person practice now, is there a final exam that you got to write? Did you write it already? Or like what's the next step now that you graduate? How does that work?
So you have to get your license.
Mhm.
So your license involves obviously your university degree,
Yep.
which is what I got 2 weeks ago from U of T, and then you have to pass a board exam
Okay.
in order to be able to practice in Ontario or in Canada.
Yeah.
And then there's obviously like a US version of that. If you want to practice in the US, you write the US board exam. I passed the US board exam last year, and then I just wrote my Canadian boards beginning of June 6th. So I'm waiting on the result of that,
I
which
have
is going to
no
tell me.
doubt that you're gonna have crushed it, man, for sure.
Oh, thank you.
But what were
Thank
they like? Were they relatively difficult, or is it one of those things where if you study and you pay attention in school, you're gonna be okay?
you. The US one was, I found it super straightforward.
Okay.
Just like off of the content we know from school and clinic.
Yeah.
Like I showed up with 4 days of studying. I felt pretty prepared and like I was certain I'm gonna pass. Canadian one is significantly harder, like so much harder.
Okay.
And it's just more detailed, and the way they ask the questions are trickier, and you have to sort of like prepare for the style of the exam. Like I've never written anything like it. They give you like there's 150 case questions and then 50 multiple choice questions. Multiple choice is MCQ, one answer of the four options. The cases, they give you like A, B, C, D, E. They give you like 15 options, and it says select all that applies, and like 3 of them are the correct answer. So if you choose all 3, you get 1 for the question. But if you choose like the 3 correct ones, but choose one that's wrong, that carries a negative value, so you get 0 for the whole question.
So basically, it disincentivizes you from guessing, because then otherwise, if you guess everything, then you get to get the wrong.
Right. So you want to be pretty conservative. Like you want to choose, like it's better to get like 70% on a question or like 80% on a question than to risk it and get a 0. So you don't want to be, so it's more like practicing for the style of the test and opposed to like the knowledge itself. Yeah, that's what's unique about it.
It sounds like, so if you want to be a dentist, to any listener out there that's listening, basically, so you go to high school, you finish that, you do your undergrad, which could be either 3 years or 4 years, because it's possible to, it might still be possible to get in after your 3rd year. Then you do dental school, which is 4 years for the most part. First 2 years are going to be more theory-based. Second 2 years are still kind of theory, but a lot more practical. And then you graduate, and then you write the board exams at the end, and then you are good to work. Is that right?
That's right.
Awesome. Good stuff. So what does that mean for you? Are you thinking about, are you ready to work, or is there more training coming your way? Because we talked about what we're going to do when we graduate and stuff like that. And it's like, you know, when you're in it, you can't really see through the forest, right? Now that you're out on the other side, you get to see what exactly you want to do for the rest of your life, right?
Yeah. Personally, I can't wait to like start working. Yeah. And I'm pretty tired of the school aspect, like 8 years straight. Like we were lucky that we got in right away. Like we didn't really have a gap year, thank God. Like we're so fortunate. But it also is draining, you know, like it was literally 8 years back to back, like semester after semester, and then you finish undergrad, you jump into dental school. So I can't do more school. Like I'm burnt out.
Now I'm showing up over here. We got like 5 minutes left. So my last question that I want to ask you, and please expand as much as you want, but I have, you know, a lot of students, they ask me, they say like, how do I know dentistry is for me? How do I know that I'm going to like the specialty? Obviously, you don't actually know until you get there, and it's the same thing for medicine, but what sort of things am I looking out for? And then what tips do you have for these people that are interested in dentistry?
For sure. So I think definitely before you jump into either like any of the healthcare fields, dentistry, medicine, pharmacy, do your research, like shadow as many dentists as you can, as many doctors as you can, watch like YouTube videos, really like assess what you're passionate about, and because it is a pretty long journey. And you will burn out if it's not something that you're into. Like we have people in I'm like probably have in your class, in my class, that drop out or go to medicine or use dentistry as their backup, or they just find out, like we had a student, after 2.5 years of the dental program, she's like, it's not for me. So she left. And yeah, it's definitely a long process. So I would say like shadowing helps a lot, like just seeing the procedures. Like I knew personally, like watching dentists, I'm like, I'd love to do that. You know, I think I'd be great at that. Yeah, I would say like, make sure you like it. And shadowing is a big, it shows you like firsthand if it's something you want to do or not.
I've been told by my dentist, because I've asked them the question, at least what they had said is that another thing too is make sure that you like the general, we call it the bread and butter, the things that you are going to be seeing all the time in an office. Because if you do work in the office, then even though sometimes you're going to have these really intricate, cool cases, for the most part, you are going to be getting, the 80% of the time, this particular type of person come in. So even just go ahead and speak to your own dentist, I think is a good way to start, and ask them some questions if you have any. And then other than that, I totally agree with you. Like, really try your best to shadow and see if this is something that you like to do. And also, in medicine, for example, there are specialties that don't require you to work with your hands. Dentistry, that's not the case. If you're going into dentistry, make sure that that's the using your hands for practical purposes is something that you like. Is that a good thing to say?
Absolutely. It's very hands-on, very much so.
Perfect. Listen, buddy, honestly, thank you so much for coming on and doing this today. I know you're super busy, so I really appreciate you coming here, and I hope that this helps other people that want to learn more about it. But other than that, I'll be seeing you soon. We'll hang out sometime in the not
Sure.
too distant future. And to everyone else, thank you so much for watching today's video. We'll see you all in the next one, and everyone take care.